My group and I have taken a look at Hai's shoulder pain, both in her right and left shoulder. She is a concert violinist, so this makes her keep her arms up in somewhat of an awkward position for a long period of time. She has found this pain to be occurring for the last 3 months. Her shoulder pain has continued to intensify over the last 3 months. After resistance training, she found that her right shoulder had a lot more instability compared to her left shoulder. My groupmates and I will be identifying the anatomy of the shoulder girdle and the joints, as well as steps to verify a diagnosis and a therapeutic plan to get her back to feeling better.
Okay, here is the clavicle. Here's the sternal end, and there is the acromion end. And now we're going to the acromion process, which serves as a point of attachment for the deltoid muscle. It's the bony point at the end of the shoulder. Now we're going to the coracoid process, which is the most concave dip in the clavicle, which is 1 inch below, and that stabilizes the shoulder joint. Now we're moving to the back, where we have the medial border of the scapula. Here we can see there is a rhomboid muscle above, and there is an insertion site which gives attachment to the levator scapulae. Here's the lateral border, which performs adduction and medial rotation at the shoulder joint. Next, we have the inferior angle of the scapula, which moves forward around the chest when the arm is abducted. It's kind of the bottom pointy part of the scapula. And lastly, we have the spine of the scapula, which separates the posterior surface of the scapula into 2 parts.
So for our therapeutic plans, we identified the left side as shoulder impingement syndrome and then the right side as coracoid impingement syndrome. So we came up with a plan that would help combat these injuries. And for the right side, for the left side, for shoulder impingement syndrome, we're going to strengthen by really emphasizing activating the lower traps and serratus anterior. So in order to do this, we can do scapular squeezes. We can do this without or with weights, depending on how comfortable the client feels and if they're in pain, or if it's too easy. Any of those factors can be accounted for the intensity of this exercise. And then for stretching, we're gonna do doorway shoulder stretch. So just holding this for a few seconds, maybe doing a few reps, maybe going further and further each time, depending on the client and how much ease they feel with this exercise. And then as far as soft tissue massage, we're going to focus on gentle stretching and then correcting any muscle dysfunction. We're going to focus really on the shoulder joint and rotator cuff, and then the massage therapist can also work on strengthening and working those upper back muscles and pecs. And then for right side, for the coracoid impingement, our therapeutic plan is going to be the same as kind of the left side. But in order to strengthen these muscles for coracoid impingement, we're going to really emphasize on strengthening the rotator cuff muscles. So in order to do this, we're going to be doing reverse flies. Again, this can be done without or with weights, depending on how comfortable the client feels. And then for stretching, we're going to target any areas of scar tissue or tightness. And exercise that we can do for this is crossover arm stretches. Again, just kind of going until the patient feels slight discomfort and then kind of progressing from there. And then as far as the massage is concerned, we can place a tennis ball below the spine and around the shoulder blade, and this will help with proper alignment.